shaping up to be an exciting week related to the COVID-19 vaccine. We have received all of the doses that were delayed due to bad weather from last week, and we're receiving our regular allotments for this week. We were able to open eligibility to Hoosiers 60 to 64 yesterday and have already seen nearly 112,000 people in that age group schedule appointments. That is more than 1/4 of the eligible population in that age group. When you add in the healthcare workers and first responders who were previously eligible for vaccine, nearly 37% of people ages 60 to 64 have now scheduled a vaccine appointment. I want to thank our partners at 211 for their role in getting so many people scheduled yesterday. They answered nearly 27,000 calls and scheduled nearly 15,000 vaccine appointments yesterday. We also are eagerly watching for the outcome of this week's FDA and CDC meetings on the Johnson & Johnson vaccine. If the vaccine receives its emergency use authorization, we could begin receiving vaccine and seeing it arrive in our states very soon, potentially next week. Dr. Weaver will share more on this. While this is all exciting news, we know that we still do not have enough vaccine to put in a shot in the arm of everyone who wants one. That is why we continue to stress to clinics the importance of following the state eligibility guidelines. Our age-based approach is driven by data and is designed to prevent hospitalizations and to save the most lives. And when clinics don't follow those guidelines, whether it's for overall eligibility or for their wait lists, they create inequities around the state or even within individual communities. When we learn about a clinic that has deviated from the eligibility guidelines, we reach out to find out why and to re-educate them about the importance of following the state's priority list. In most cases, this conversation is effective and we see adherence to the guidelines going forward. I want to emphasize that the clinics have been amazing partners to us. To have administered as many vaccines as we have in such a short amount of time is a testament to all of their hard work. Unfortunately, there have been instances recently in which a clinic has ignored the guidelines and hosted special clinics for ineligible individuals. In these cases, we have told the clinics that we will not provide them with any additional first dose vaccines at this time. We will, however, provide enough to be able to cover the second doses for the individuals who were vaccinated. And we will work with them to develop a corrective plan of action to determine our next steps. And we will reallocate the doses initially intended for these clinics to other sites within the county so that the county's total allocation is not negatively impacted. We are not trying to be the vaccine police. That is the last thing we want to be. We are trying to ensure that we have ethical and equitable access to the vaccine across all 92 counties based on what the data show are the highest risk individuals here in the state of Indiana. We cannot achieve that goal if sites deviate from the guidelines. We are committed to working through issues and establishing new procedures, but while the vaccine remains a scarce resource, we need to ensure that everyone is following the same guidelines. We have a lot to be proud of in our vaccine rollout, and that's where we need to keep our focus. This week, we have increased shipments of masks and other supplies to critical industry, businesses, and schools. To date, we have shipped 204 orders to businesses consisting of nearly 19,000 KN95 masks, 604 gallons of hand sanitizer, and 23,000 packets of small sanitizer. Nearly 280 schools have received deliveries so far, with another 41 expected to be completed by Friday. These shipments include nearly 19,000 BioNXNOW rapid tests, 97,000 youth masks, 97,000 KN95 masks, 76,000 gowns, 76,000 gloves, 43,000 gowns, and 200